First of all, HIMSS, in many respects, is a virtual organization. So in reality, this won't be the second place. It'll be the umpteenth place of a HIMSS presence. We're headquartered in Chicago. We have offices in the U.S. in Ann Arbor, Burlington, Vermont, Portland, Maine, Washington, D.C. We also have offices in Brussels, Berlin, and Singapore. So we're globally about 360 or so employees, have an annual budget of about $80 million. We are a not-for-profit organization that has members as a core. There are about 55,000 individuals worldwide who are the members of HIMSS. But as I mentioned in my remarks, we actually focus on a much broader audience than members, much like the question that was asked at the beginning of this meeting, how many are members and how many aren't. The reach of an organization typically is far beyond those who have signed up as members, because you have information that someone else wants. And it sometimes can be just a periodic exchange versus an ongoing one. And so we do. We have about 500,000 people worldwide who are accessing our educational programs, our networking opportunities, our tools and resources, our media services, our analytical services, and that sort. So as we look at what we are trying to do, and the mission of the organization is better health through information technology, we look at various opportunities to achieve that mission. And so we look at a variety of different options. We look at a variety of different geographies because we are not U.S.-centric. We look globally. And so what drew us here was the work that was, the thinking that was going on into what has become the Global Center. It's an opportunity for us to do on an ongoing basis the demonstration and testing of innovation and technology in a location where we expect there is an ongoing watch of the world in the healthcare arena to see what's going on. You look at the lineup of companies, starting with your local institutions, such as University Hospitals and Cleveland Clinic, who are there. You look at one of your major employers in the health information technology space, Hyland, who's there. And others, Johnson Controls and others, Philips, numerous big names in healthcare. This is going to bring a tremendous focus on the work that's being done here in terms of healthcare innovation, not only in technology, but across the spectrum. We're faced with, if we stop and sort of step back and think about what we're reading about in the newspapers and magazines and watching on TV about what's happening in Washington, if we step back from the rhetoric and think about what's going on, we've got a healthcare system that's in desperate straits. It's a healthcare system that is not sustainable for the long term. It has the potential of bankrupting the country. So we've got to get a handle on this, so we've got to find a way to drive costs down and drive quality up. So it's activities such as this that we think are key initiatives to help further that goal of lowering costs, improving quality, and therefore improving the overall healthcare system. So that was really the reason why here.